An estimated 2.7 to 6.1 million Americans are living with atrial fibrillation, also called AFib. AFib is the most common type of irregular heartbeat or arrhythmia and is associated with an increased risk of heart failure and severe and debilitating strokes. Getting an AFib diagnosis can be scary and confusing, but the complications of AFib can usually be prevented with proper treatment, allowing most people to live normal, healthy lives. So if you have AFib, talk with your healthcare professional right away about your individual risks. Together, you can make a treatment decision that's right for you. AFib results from a problem in the heart's electrical system that controls its rate and rhythm. The disorganized electrical signals cause the heart's chambers to beat irregularly and often rapidly. This can cause pounding or rapid heartbeats and other symptoms like fatigue, fainting, and chest pain. When the heartbeats are very fast, the heart's ventricles can become overworked, eventually leading to heart failure in some patients. The irregular rhythm affects the way blood flows through the heart and makes it vulnerable for forming clots. Those clots can then travel from the heart to the brain and block vital blood flow and oxygen, resulting in a stroke. This type of stroke is called an ischemic stroke. AFib-related strokes are more deadly than other types of stroke. In fact, stroke patients with AFib are as much as 70% more likely to die than those without the disease. Those that survive can experience paralysis, loss of speech, impaired brain function, and other disability. But a great many of these strokes can be prevented. In addition to treatment to restore the normal rate and rhythm of the heart, your healthcare professional may prescribe a blood-thinning medication or anticoagulant that reduces the risk of stroke from clotting. There are now a number of oral anticoagulants available that work in different ways with different benefits and risks, allowing the healthcare professional and patient to choose the right drug for them. Despite the effectiveness of blood thinners, around half of all AFib patients are not taking anticoagulants. For some, this is because their risk of stroke is very low, but in many cases, it's due to concerns about bleeding risk. Because anticoagulants affect the blood's ability to clot, they also affect normal clotting, making users more vulnerable to bleeding and more likely to notice things like easy bruising or small cuts that take longer to stop bleeding. In some cases, bleeding is serious and happens in the gastrointestinal system or brain. If the bleed occurs in the brain, it causes a type of stroke called an intracranial hemorrhage. These strokes can be deadly or disabling, but are different from ischemic strokes, which are caused by clotting. It's important to remember, though, that most bleeding is manageable and that fatal bleeding from anticoagulants is very uncommon. Making a treatment decision about stroke risk reduction requires both patients and healthcare professionals to balance the benefits and risks. For most AFib patients, the benefit of preventing AFib-caused strokes outweighs the increased risk of bleeding from the medication. This is true even for most older adults who may be frail or have an increased risk of falling. Studies have shown that most falls, even those that result in broken bones and other complications, do not result in intracranial hemorrhage or brain bleeds. In most cases, frailty, age, and fall risk should not be barriers to anticoagulation therapy. If you or a loved one has been diagnosed with AFib, be sure to talk with your healthcare professional about your risk factors for stroke, including family history, medical history such as heart disease, diabetes, elevated cholesterol, and high blood pressure, and lifestyle factors like smoking, caffeine use, other medications, exercise, and diet. Discuss the different oral anticoagulants and which is right for you. Also discuss anything that could impact your ability to follow medication prescribing instructions, like memory loss, access to clinics for monitoring, difficulty paying for medications, and diet. Also discuss any changes in your health, symptoms, or side effects from your medication. Don't skip doses or stop taking your anticoagulant without talking with your healthcare professional. Doing so may increase your risk of stroke. Even though you may not feel differently, the medication is working. Remember that anticoagulants are treating your stroke risk, but not your AFib. So continue taking any rate or rhythm control medications you have been prescribed. Regular contact with your healthcare professional, even for the newer drugs that require less frequent and different types of testing, is important to make sure your treatment is working for you. Seek immediate medical attention if you notice any of the signs of stroke: face, sudden drooping or weakness on one side of the face; arm, sudden weakness or numbness of one or both arms; speech, difficult, slurred, or garbled speech; time. The faster the treatment, the better the outcome, so seek immediate treatment and call 911. Remember, being diagnosed with AFib can be frightening and overwhelming, but you are not alone, and with proper treatment, you can greatly reduce your risk of complications. To learn more about the causes, risk factors, diagnosis, and treatment of AFib, watch Living with Atrial Fibrillation on YouTube and visit www.agingresearch.org/atrial fibrillation to learn more. Brought to you by the Alliance for Aging Research.